So I said we've got three presentations from three great colleagues from China, Rwanda, and Germany, and then we're going to begin with Dr. Chen. And Dr. Chen is a director from the Chinese CDC with a vast background in animal-borne disease, particular interest in rabies, and is going to speak to us about promoting legislation in relation to dog-mediated rabies elimination in China. Dr. Chen, you have the floor.
So could you see my screen? Could you hear me?
Yes, we can see you and we can hear you.
Okay.
Brilliant.
So good morning, good afternoon, and good evening, ladies and gentlemen. I'm very honored to share our experience on promoting legislation in relation to dog-mediated rabies elimination in China. I'm from China's CDC, Division of Infectious Disease Control. So I will give a short introduction. So my outline is divided into three small sections. First, I will introduce some background, and second, I will share how did we promote legislation in China in relation to dog management and vaccination, and last, what we achieved and lessons learned. So you know, rabies is preventable, but still cause heavy burden worldwide. Rabies still exists in over 150 countries and regions, deprives 59,000 lives annually. About 99% of human cases was caused by rabid dogs, and 80% of human cases living in rural areas, and 40% under 50 years old. So to curb this trend, and in February 2015, OIE, WHO, FAO, and Global Alliance for Rabies Control jointly launched the End Rabies campaign. And in December 2015, the Global Rabies Conference endorsed the vision of zero human rabies deaths by 2030. We also called zero by 30. Actually, this goal is perfectly aligned with the United Nations SDG, Sustainable Development Goals 1 and 3. And in 2018, OIE, WHO, FAO, and GIRC jointly issued the Global Strategy Plan for Elimination of Dog-Mediated Rabies. Both on the international experience acquired from both developed and developing countries, dog immunization is the core strategy to eliminate dog-mediated rabies. Achieving and maintaining a dog immunization coverage of over 70% can effectively interrupt the rabies transmission among dogs and from dogs to humans. In addition, dog vaccination costs much lower than that caused by human post-exposure prophylaxis. And legislation on dog management and vaccination is very important to ensure the sustainable and high vaccination rate. So what is the situation in China towards zero by 2030. The epidemic situation of rabies in China continues to decline since the peak of year 2007. But China is still one of the highest rabies burden countries among the world. In year 2021, there are still 157 human cases nationwide. The good news is that it already decreased over 95% compared with that of 3,300 in year 2007, and the epidemic areas shrunk. In 2021, there are only 160 districts and counties that involved that have the human rabies cases reported. Has been decreased over 85% compared with that about 1,000 districts and counties involved in year 2007. So what is the gap towards zero by 2030 in China? We have two assessments using scientific methods. So we do the initial SAI assessment in year 2019 based on One Health approach. You know, SAI tool, it is a stepwise approach to rabies elimination. It is an international tool to evaluate the process towards the goal of dog-mediated rabies elimination. In year 2019, in collaboration with US CDC and China Animal CDC, China CDC held the SIE workshop. Being involved a national team from China CDC, China Animal CDC, and also National Reference Lab. We also involved 12 provinces that representative from high burden, mid burden, and low burden in China. For each province, we have two representatives. One is from CDC and the other is from Animal CDC. We also invite some international observers from WHO, OIE, WPA, World Association of Animal Protection, and also US CDC China office. So based on the results, the common gaps, limitation, and barriers in China, both at national and provincial level, are as following, including a surveillance system for detecting and reporting animal rabies cases, infrequent information sharing between different sectors. Dog registration is infrequent in rural areas, and dog rabies vaccination coverage is very low. And we also lack of integrated by-case management and no sensor data on home, stray, and free-roaming dogs. Lack of strategic plan for dog population control. Also lack of laboratory diagnostic ability for animal rabies. Difficult to update specimens from human and animal human cases. We also lack of systematical IEC for different subpopulations. Also lack of national strategic plan, lack of One Health cross-sector communication mechanisms, both on national level and provincial level. We lack of flexible mechanism. And in relation to legislation, we lack of regulation for dog management and vaccination at national level. We have some legislation in relation to dog management and vaccination at some provinces. we in about 12 provinces and also more than 80 cities at that time, but we have no such regulation at national level. So you can see the legislation in door measurement and the vaccination is a burning issue in China. When our facing the goal to 0 by 30. So how do we promote the legislation? How do we promote other workers in China based on our scientific evidence? First, we disseminate the findings from the initial SIE assessment on the domestic stakeholders roundtable meetings. And we also share our lessons on United Against Rabies Forum in 2020 to create a good international environment for us. And also we publish our results on scientific journal. We also made use of some of famous experts and also some the official media. We hold multi-sector seminar and we invited a very famous experts from disciplinary and also some representatives from MOH and MOA and also from some international organizations such as WHO, FAO, and WPA. And also from the USDC China office. On the seminar, we disseminate our results and also reach an expert consensus on China's next steps towards 0 by 2030. Among those, and really the important issue is to call on legislation on door measurement at national level. We also invite some very famous journalists to attend this seminar. For example, journalists from the Xinhua News Agency and Health News. We also had this journalist to write special reports and present this report to leaders at high level. In China, high level, our leaders at high level pay much attention to the special report by the journalist, especially through the very popular official media. We also speak out through a professional committee. We established a rabies working committee and the Chinese Preventive Medicine Association. He has a very profound impact in China in August 2020. And now we have 54 committee members in this rabies working committee. And this rabies working committee is consisting of multidisciplinary, such as preventive medicine, clinical medicine, veterinary medicine, and vaccinology, and also some representatives from NGO and from the enterprises. The TOR for the rabies working committee, including disseminate expertise, knowledge, and also provide advice to government. So this rabies working committee is very active after its foundation. It held academic seminar annually, and also a training workshop for the professionals at the grassroots level, and also provide some public education to the public. What is the most important is to advocacy. Yeah, they write some the report to the government to call on China set up national strategic plan. China set up the legislation at national level to improve the situation about the dog management and vaccination against rabies. And we also do some advocacy at 2 sections in China. Sorry. You know, two sections is NPC National People's Congress, and Chinese People's Political Consultative Conference is a very two important political conference in China. So, for example, and in year 2019, George Gao, and our former director, and he is also a very famous scientist in China. So he has have a proposal. The topic is strengthening the dog responsibility of grassroots government to increase the dog vaccination in rural China. And our Chinese DC also, in collaboration with China News, a very famous official media in China, his target population is the politician at high level. We
Dr. Chen, it's Duncan here. You've got one minute.
Yeah, I almost finished my. Yeah, thank you. I'll almost finish. So we have a special issue on rabies at the 2 sections in 2019. We call on legislation on dog management at national level. We deliver to the representative of the 2 sections. We also deliver to the 100,000 readers who are mainly the politicians at the provincial level and local levels. So, finally, we promote the at national level. We revise the animal the law of the law on the animal epidemic prevention in last year. This is my last slides. So on the revised copy, the dog owners responsibility is mandated against rabies. For example, the dog owners have to registration vaccination against rabies, also avoid injuring others, and the revised copy also mandated the government accountability on management of stray dogs and cats. That's a very important step forwards in China. So our experience is that One Health approach is very important, and also I think the evidence-based is necessary, and it is very important, and also effective ways to make use of experts and medias. Of course, our efforts is not only driver to promoting this law revisement, but I think it's very important for us to show some lessons experience. That's all for my presentation. Thank you very much for attention.
Dr. Chen, that was brilliant. And public health in action. And the progress that's been made has been fabulous. I mean, those numbers are incredibly impressive. And you've described the process you went through, and then the 2 critical things right at the end about individual responsibility and municipal responsibility coming together. We couldn't ever give justice to everything in that short presentation, but you did brilliantly. Thank you, Dr. Chen. We'll move on to Dr. Sabin. Dr. Sabin is a member of the executive of IANPHI, so we know each other very, very, very well, and was the former director of the Rwanda Biomedical Center, and is now the Director General of the University, the Teaching Hospital in Bhutan. Dr. Sabin, do we have you?
Absolutely. Thank you so much. I'll be sharing my screen. Let me know if you can see it.
And yes, then, we can see it and hear you. Yes, we can see it and hear you.
All right. Thank you so much, colleagues at IANPHI and members. It's a pleasure to share something I called Science, Leadership and Community. It's actually a reflection from the last 2.5 years responding to COVID-19, the experience of Rwanda that I had a chance to lead the National Public Health Institute throughout this process, and now moving into teaching and research at University Hospital. So the way I want to go through it, it's just sharing and reflecting with you, starting from the strategic pillars and our global health security agenda with prevention of diseases that are actually caused by environment, waterborne, zoonotic, that are coming with outbreaks in many ways, COVID being one example. There's this pillar of surveillance and early detection of threats and capacity building and skills transfer and partnership, how we respond to pandemics, and then globally, because this is not a local issue, it's a global issue and become a pandemic. How do we deal with that and how we work together to make sure what we do is aligned and there's an equity and the global health regulation is put in place. So for those who are not frequently into this discussion of pandemics and response, there are actually these key components that I want to highlight here as these public health warning indicators and systems that will track and alert any potential disease to happen and stop it before it spreads, the disability to get enough and real-time data to know how you respond to that, and also is that coordination from community to the science to the leadership. And of course, as my previous speaker mentioned, having protocols and policies and guidelines is critical. But again, how do you sustain that? By teaching, by developing capacity in the system, and also working with others. So I picked this structure of coordination of how Rwanda responded to COVID-19. This is really a centralized and decentralized system on the coordination from National Command Center at the Office of Prime Minister, different sectors working together with expert advisory team. This is again the science part, and the partner coordination. This is a partnership. And down to the district and operational levels, we have epidemiology response, surveillance, point of entry. We have case management, rapid response, IPC, isolation lab data, and of course administration is key. With all these rapid response operations, you need really a strong financial administrative team and logistics. And of course, communication has been really, really critical, as miscommunication can be as dangerous as the virus itself at all levels. So this structure, just a snapshot of how it was coordinated, to me, it can be also summarized on this triangle of three things. The science that actually dictates, actually guide people on what should be doing, the leadership that is informed by the science, and then the community that takes action and decision made by the leadership, trusted by the science. Then the community will trust both the science and the leadership. This is how I frame this discussion, because having gone through that, trust cannot be made or strengthened if there is disconnection between these three groups of people. And I like how this topic of today webinar is actually framed up about science and how we use science for decision making. Again, this is in practice from the evidence to the decision making for community support is for the community wellness. We are all part of the community anyway, being politicians or scientists or leadership. But in the case of Rwanda has been always this channel, this way of managing COVID-19. And every time this process was yellow paper every 2 weeks of it, owned by the science, coordinated by the leadership, but also implemented and trusted by the community. And to ensure that community makes that use of it, scientists have to go out and speak to the community in the language they understand, and that this continuous cycle has helped a lot to make the progress. From the day one when we formed the scientific advisory group of COVID-19, we were just less than 10 people on this picture, and by the end of a month, we were already 100 people meeting real time, every time, just to discuss everyday developments on COVID-19 and communicating every night on the key actions and data on COVID-19 in Rwanda. So trust has been a key point, but when do we need to start and build trust? So we don't really build trust when there is already a house in fire. So when there's in the middle of the pandemic, trust has to be built before, and it's a process. It doesn't have an end point, and it's very critical in prevention, in supporting and making sure people have these habits of public health measures, like cleaning hands, prevention of other types of diseases, educating people using the right communicators and giving it in the right they want to understand it, diagnostics and communicate what the result, decentralizing, simplifying what we do, and making sure that community health workers in countries with limited resources can do that, but also treat and innovate is important. Also to care and inspire young generations, but treating a person comprehensively is key, not just a virus or pathogen, but also hoping that things can move from the worst case to the best case, and believing that science works, like vaccination, which has been key. So this is how the current situation looks like. In Rwanda, we went through different waves, but now we can say that the power of science is showing up. Even though the cases have going up in different waves and coming down, but we see that there are very few critical cases on the bottom of this slide. While the number of cases can increase, still hospitals can be protected. And again, population needs to understand what it means. So to summarize and probably to cut the story short is the most important thing, the lesson we learned: trust, connections, working together, but also using existing structures to make sure we don't start from scratch. We've seen that with our labs, people, and hospitals, but also adapting what exists and face these challenges, but at the same time building our own health systems. Data use has been key, and technology, even in areas where we think that it could not work. But how also can we ensure that we decentralize and ensure that at the community level, you can test, you can treat without coming to a teaching hospital like this one. But all in all, long run, strengthening our health system is the best way to control future pandemics and the current one. So this is a two critical and important examples I want to highlight from, at least from Africa. The oxygen production capacity that increased incredibly high very quickly. We don't have issue on oxygen, for example, in any hospital in Rwanda. And this happened because, I mean, we went through COVID, we struggled, but at least it helped to strengthen our systems. And now we're discussing about about vaccine production in Africa, because we consume 99% of that, same as the science output is only 1% from sub-Saharan Africa. So how can we leverage that and expand is through partnership, through leadership, but also taking science borderless and make sure we continue to work together like in this session. Let me summarize this by saying that we learned a lot. We still have a lot to do, but we have the capacity that we can leverage. But the most important thing is trust, partnership, leadership, and science for the community. Thank you.
Dear Dr. Sabin, fabulous. And trust, you're opening. You don't begin to build trust in the midst of a crisis. What you were setting out there is a case study for all of us. And the two charts you showed of the impact of new cases, and then what did that mean for critical care was fantastic. We should light that up for the world, Dr. Sabin. We'll move straight on to Professor Lothar Wheeler, and then we'll have time for Q&A. Again, Lothar is a member of the IANPHI executive. It's the president of the Robert Koch as the leading public health authority in Germany. And Lothar, are you good to go?
Yeah, I am indeed. Thanks. Good morning, good afternoon, good evening to all of those who are listening to this session. I'm really glad to see all of you, and thanks, Duncan, for having invited me. I will just give a brief insight into how we at the Robert Koch Institute think science and policy comes together, and how we fulfill our role as public health institution, at least in a country like Germany, which is a federal state, which is very important to understand. Brief introduction of the National Institute. The Robert Koch Institute has been appointed the National Public Health Institute only in 2008. And our tasks are basically listed on the left side of the slide. So we are in charge of collecting and analyzing health-related data, of course, from all health-related issues, not only infectious diseases. We are in charge of planning measures. However, when it comes to implementation, this is a very rare event if some federal states ask us to support, but in general, we are not in charge of implementation of measures. We are in charge of communication with relevant target groups on public health aspects. So communication clearly, apart from all the other duties that we perform in our institution, communication is a key issue, obviously. And this all can only work if we are strong in science. And therefore, I will stress this again at the end of my talk. Scientific excellence, scientific quality is the basis for a good communication, and also it's also the basis for trust, because if you are not a good scientist, how can anybody trust in your recommendations based on scientific evidence? So today I'm just going to talk about communication, and I want to make clear that again, this is really very important to understand. In Germany, implementing measures, this is the local level of our federal state is in charge of implementing measures. Even the German chancellor cannot tell local people how to implement any measures. That's really important to understand. So I consider, or we consider, that there are 4 principles that make it very important if you want to give advice to politicians. It's an ideal typical framework, which obviously doesn't always fit 100%, but this is the ideal basis for policy advice. So distance is really important. There needs to be enough independence that the science really can work smoothly, and that it works freely with enough resources. Very, very important, so that there is not too much mixing of interests between the scientific judgments and the political judgments. You need to have plurality, which means that many disciplines and advisors should be involved. We have seen this in these two talks before. And of course, there needs to be transparency as much as possible. Obviously, you cannot be transparent about each and every step, but you have to be transparent how the decision-making processes really work, because also, again, this is, otherwise you can't gain trust. And of course, then you need to bring the particular information out into the public. And again, this is needs to be very, very relevant information, clear information. Again, the prerequisite for trust. And I think Sabine has mentioned this several times. Trust is the key issue here. So when we talk about talking to any people, we must be trusted and trusted entity. Otherwise, how can we be understood or appreciated by others? And this is the model that personally I prefer how scientific policy advice is given. There are 3 different models. The Machiavelli model, very, very old model. There are other models, but I think this model fits best. The RIU model, as it's called, it has been published by a German research group, formulated. So basically there's research, and again, state-of-the-art research. It has to be excellent, obviously. And there's utilization, which means that some political actors use this research, and administrations use it. Citizens, of course, also should be able to use the scientific evidence that is generated by, for example, a National Public Health Institute. And then there comes this process of integration. That means there are obviously bidirectional interactions, because of course, not all biomedical advices can be taken when it comes to a whole of society approach, and when it comes to other issues that are perhaps even more important than just protection of an infection, clearly. And so we have to give orientation towards public goals. We have to have relevance to political process and relevance to allies, and the information need to be targeted, group oriented. So, but why I like this particular model here is that the scientific research has to be independent. It's one pillar, and the other pillars come out of it. And we just using basically the public health cycle. So it's a cycle that's always going on. And during this pandemic, obviously we learned a lot, and oftenly had to shape our advices based on evidence, particularly, of course, the evidence that this pathogen is transmitted by aerosols, which was a huge impact, of course. So effective communication is, why do we need it? It's clear we need to inform people. The trust needs to be there. We built up this trust over the last 30 years. We need to build trust in peacetime. And something that was much more important than I personally had appreciated before is there is infodemics, and this infodemics is, whatever reason for this is, there even official other countries, for example, that are particularly trying to destabilize information in a particular country. You need to promote dialogue, and of course you need to make people understand how these recommendations work and why they are important. So you have to assess the situation. You need, as much as possible, transparent information about the situation. We all put situation reports on our websites. We give press conferences, social media, and so on and so on. We're using all these different channels. We also have to answer questions. We have to be self-critical, which is really tough in the time of crisis, because you are so overloaded with work. You need always to need people who look from the outside of what your performance is. You need to proactively disseminate information, for example, on vaccination, which is another topic where infodemics comes in so much. It's really amazing how much misinformation is actively put into the population to put distrust into vaccination. You have to be in interviews, you have to put the message out, and of course you have to communicate also with the scientific community, which is also not an easy task, because single scientists obviously have different ideas, concepts, and different knowledge. So the question that we rose, can scientific evidence speak for itself? Obviously, it does not always work like this. It's more complicated. It's clearly that policymakers are in a bad position sometimes. They often deliberately what hangs in the balance. Yeah, it's really not easy, and clearly we can help them with scientific evidence. But in the beginning, of course, some of the recommendations couldn't be based too much on scientific evidence because it was simply missing. And therefore, it's really not easy to be understood by policymakers why they should do this or that. And this needs to be communicated very, very clearly. I just put in some issues here that are much broader than just biosafety and infection protection control. So the challenges during this pandemic, I guess you all agree with me, was the finding the right balance between the evidence, the legal framework, and the implementability of recommendations. We produced evidence-based recommendations, but of course, this has to be put into legal regulations by politicians. We give advice here, but we have not whatsoever meaning in this legislation that will be filed then by democratic parties and the parliament. Obviously, we all suffered from limited resources because the situation was changing rapidly, oftenly, particularly when it comes to the virus changes or genomic changes. There is a huge expectation of the press, particularly on data. And we all know that data need to be quality assured, but these journalists just want all the data as soon as they come out of basically from the medical doctors. But we need to put some quality measurement here. And obviously we were challenged by many experts that didn't have any technical expertise, because by the media, they were just put into the same background basically as scientists. Again, the infodemics I mentioned already, communication triad, I will take a closer look at this later on. Infodemics, I don't want to go too much into this. I just want to stress this again. In the beginning of the pandemic, did not expect that so much proactive infodemic was taking place. And you know that WHO has set up several seminars on this webinars, very, very useful, very, very important. We need to be better prepared against these infodemics. We proactively have to put countermeasures in place in the future. So this is of course important because policymakers are influenced by many people. They are basically open to all different information. That's why they are politicians. They listen to people. They have to listen to people from different stakeholders. And it's not only that suboptimal information undermines the public health response to a pandemic, but also this disinformation really polarizes public debate, and it promotes distrust. That's very, very clear. And this is a topic that I think we should put more effort in the future on. And during peacetime, we really have to teach people what sources are accountable and which are not. So this is a communication triad that I briefly mentioned. Basically, you all know what I'm talking about. We have the political communication, we have a scientific communication, and you have a media communication. And here I just group those who are important, who have been important, still are important in Germany. And there are, in Germany, for the scientific communication, you have various players, apart from individual scientists, various institutions. And these institutions, of course, do not always perfectly match in their communication. Usually they do, because if one person, basically the head of this particular institution only would communicate, but obviously also others are communicating, it's not easy to really match this always. Media communication is totally uncontrollable, of course. That's in a democratic society, there's plurality. That's the basis of our whole democratic societies. And of course, political communication is very, very different and disparate. Why? Because there's also always an opposition, and there are various different goods to save, and the interests are very, very different, to be honest. So this triad is not easy to control. Basically, it is not to control, and therefore it's really hard to build up trust. So in Germany, who communicated the evidence during this pandemic, Leopoldina, the National Academy of Sciences, had position papers, which were all very helpful. And of course, the National Academy of Science has a scientific background. There's another academy which also published 8 position papers. There's an ethics council which published 7 ad hoc recommendation and position papers. And all of these were, of course, not coordinated. That's for sure. And there are medical scientific societies that gave various statements. And of course, there were many, many informal advisory bodies of the Federal Minister of Health and the Federal Chancellor with changing occasion-related composition. And they didn't make any public statements, but a certain number of people had direct impact on the decisions of these leading politicians. And since December, there was a change. An expert-appointed committee now gave recommendations, and they put out 12 position papers so far. So the take-home message basically is, and this we all know, but the question is, how can we really provide it? Communication is essential, yeah? And there are so many challenges that really need to be overcome, not during crisis, but before crisis. We need to build up trust before crisis. This IAU model describes how advising politics works. Again, I can only say that scientific excellence must be the basis of it. Otherwise, we are not independent scientifically if we're not excellent and have quality, high quality. It can be challenged, the communication, the evidence, if it's not coherent, when it's coming from different sources. That's basically a huge challenge. And we have to promote dialogue with society. So there needs to be public engagement. Again, this has to be in peacetime already. And we have to communicate transparently. That's basically my talk. Thanks. And I'm looking forward to the discussions.
Thanks. Thank you so much, Lothar. I mean, the synergy between what you had to say, Dr. Sabin and Dr. Shen, is very clear. And 3 masterclasses. Lothar, I would just add one thing. It was almost the very last point. In building trust, being able to say what we don't know is often as important as that we do. And when we overclaim the science, we undermine it. That was another brilliant masterclass. Thank you. I'm being assisted by Marie, because I'm operating off my phone, about raised hands and questions in the chat box. Marie, can you help?
Yes, then Ken. So Bjorn Iversen would like to ask a question.
Thank you very much. And thank you very much for the 3 very good presentations. I would like to follow up on Duncan, because one of the big challenges for us is how to give advice when there is no science. And it's mainly then for Lothar. And one thing is for pharmaceuticals, for vaccines and medications, there are lots of research about the quality and the side effects and so on. But for public health and social measures like school closures, face masks used in public, and so on, there is hardly anything. And still we are asked to give advice based on non-science. And I discussed with a representative of the European Centre for Disease Prevention and Control recently. They're about to publish advice on face masks, even though there are only 2 not best quality randomized control trials about the face mask use in society. How should we as scientists in public health deal with this, and how should we give advice when there is no science? Thank you.
If there is no science, it's obviously hard, and you can only discuss with plausibility, and you give examples from other areas. But obviously there's enough science now that we know that masks in particular areas, in particular settings, work. I mean, this is for sure. And as soon as we knew that this virus is transmitted via aerosols, we all knew that wearing masks and wearing them rightly makes a difference and reduces the risk, although there were no data in the beginning that it reduces the risk of transmission of SARS coronavirus. But obviously there has been a lot of evidence that other viruses you reduce the risk of getting affected if you wear certain masks. I mean, so you can of course easily discuss this, but you then have to discuss the science properly. And you say, if you always make this black and white discussion, and you're always asking for randomized control studies, you obviously are in a problem. But if you talk about scientific evidence from other areas which are plausible, you can do this. And I mean, this is, I would never agree to say there's no science. And we all know that a disease that is spread through this particular transmission pathway, there are certain physical issues that help to reduce the transmission. Now, the other issue is, if it comes to closing schools, for example, in Germany, the Robert Koch Institute did never recommend to close schools, but of course, we recommended to reduce the transmission of viral infections in schools by certain measures. And what I understand in these particular discussions is that we always have a black and white discussion, and this disrupts the discussion. So the grayish in all of this, risk reduction by a certain, be it 5 times or 10 times, 0 risk and 100% risk. This is what is usually in the open discussion, because there's confrontation, which is set by particular people. But we should be open enough to discuss this. And if we are able to do this, that's fine. But of course, we can never, at least in a democratic system, you can never overrule all these different positions. In other systems, you may be able to just bring one concept into living. Yeah? But this is something we have to cope with. And this is why we need, which I didn't mention, but we all know, we need an educated population, of course. We need education. This is at the core of all of this.
So, Lothar, I think my picture's frozen, which means no one can see me waving my hands as a lovely answer. And I think there's a whole understanding about risk communication, about relative risk. We in the UK benefited from a professor who works on this particularly at Cambridge, and he just was able to, actually, as Dr. Sabin talked about, is how do you talk about things in a way or in a language that people can understand. And so again, it's back to good communications. I'm terribly conscious, as always, time is not on our side. Marie, did we have another question? We may have time for just a quick question. So
we don't for now. We don't have anybody raising their hand.
Okay. Then in that case, because it's approaching 5 o'clock, at 4 o'clock, or wherever you are in the world. I wanted to say, I mean, I think this is just such a marvelous subject to be discussing, and the 3 presentations will be of immense benefit. I know this. I mean, I know this for myself and where I am, and I know for others around the world that these 3 presentations will be of immense help to all of us in how we think about what we learned through the pandemic, and also before, as Dr. Chen talked us through, and bring that to bear in discussions that we have in our various jurisdictions. I used to talk in the UK about having arguments was important, but winning them was even better, and how you win those arguments when actually science is important but not sufficient is a public health expertise. And I think, as Lothar said, we need to get, all of us need to get better at this. But there's so much to build on and masses to be proud of, and that was very energizing just hearing these three stories. Can we conclude by thanking everyone? Obviously, our 3 speakers, Dr. Shen, Dr. Sabin, and Prof. Wheeler, but also everyone involved in the organisation of the webinar, and even more so all those that have listened in today. We will ensure that the slides and the recording will be available by email and on the IANPHI website very shortly. So I'll end by saying thank you, good morning, good afternoon, good evening, and good night. Bye-bye for now. Bye-bye.